we tend to look at the body as a whole, right? So you have different systems in the body. You have and different channels in the body. So you have the spleen channel, you have liver channel, kidney channel. You want the qi to be sufficient and running smoothly through all these um, meridians or channels.
Hi, Dr. Lim. Thank you so much for joining Staying Ageless today. I'm really excited to have you.
Oh, thank you for having me. So it's nice to be here with you.
Um, let's start with, I always like to get just a little background on how people ended up doing what they do. So if you could explain, like, what led you to become a doctor and acupuncturist in the first place?
So basically, when I was in, I guess, high school, college, I've always been interested in health in general, and I've have a lot of movement background. So when I was in college, I studied Shaolin Kung Fu and martial arts, and that whole practice got me interested in energy and just chi and more holistic ways of health. And so at that time, I was very interested in acupuncture and how acupuncture works. And so at that time, I decided to go to China to study acupuncture and Chinese medicine. And also, I think it's also because I grew up in a family where my mom, she always gave us herbal medicine whenever we got sick. So she never really gave me antibiotics or a lot of Western medicine whenever I was sick. And so I kind of grew up with that general knowledge of Chinese herbal medicine. Um, and
Yeah.
so And so when I went to China to study Chinese acupuncture, the herbal medicine, I didn't realize how widespread the herbal medicine is used in China, and also how integrated the Western and Eastern medicine is in the hospitals there. And so that whole experience made me really appreciate just the use of the herbs together, in the care of patients. And then I also, at that time, I also had my own gynecological issues. And I used to have really like heavy crampy periods. And so I found, and during my studies there, I remember I decided to try using some of the herbs on myself and to help with menstrual issues. And I found it was like so helpful for me. And so that got me even more interested in the whole gynecology aspect of Chinese medicine. And so then then I got my degree and my license, and then when I was studying here in the States, I saw that there was a doctoral program for fertility and women's health at the Yosan University, and so then that just started my whole, journey, getting even deeper into Chinese medicine for fertility and women's health. And then I met my boss, who's at the TCM Healing Center, and so she also specialized in fertility and women's health. So we kind of clicked, and then I've been there since then. So, so
That's
that's how.
super cool. You mentioned that in China, they integrate the herbs very much even in the hospital setting. Can you break that down? Because I would love to hear about that.
Yeah, so basically in China, it's almost like a Western medicine hospital where you have your different departments. So you have your gynecology department, you have your gastrointestinal doctors, you have your oncology department, you have you know, um, I don't know, what else? Dermatology department, for example. And each department, so it's a little bit different from here, where let's say you're at the clinic and one doctor can treat, like there's no how do you say, differentiation of the different specialties in the hospitals here, right? So in China, you actually have like a TCM hospital where you have the different departments, and each department, they specialize in, let's say you go to gynecology department. So that doctor, she's experienced in both Western and Eastern medicine. She can prescribe
Wow.
Western medicines if she needs to. She can do pap smear, she can do gynecological exams, and then she also will prescribe the TCM herbal medicine for the patient. So she's usually sitting there at a desk, or the doctor's usually sitting there at a desk, and people line up, one after another to see them, and they check their pulse, look at their tongue, they order any Western um, tests they need to do, like if you need to do a hormone panel, for example, and then they get the results, and then they can prescribe the herbs right there for the patient. Then the patient goes
Wow.
to
Super cool.
yeah, so it's practiced very differently. So the acupuncture is a department in itself, right? So the if a patient wants to get acupuncture, they have to go to a separate department just to get the acupuncture. But most of TCM, I would
Okay.
say, a lot of it is actually the herbal medicine is the main part. Yeah, which I think people here don't always realize, especially for fertility. I think a lot of women only get for acupuncture here. They don't necessarily do the herbs, but in China, it's like if you're working with women's health, fertility, it's a lot of the treatment is actually the Chinese herbal medicine, and then the acupuncture is just kind of a adjunctive or additional treatment.
Okay. So I just want to understand Chinese medicine better. So like I feel like I feel like it's complicated to some degree, but I feel like maybe you can break this down for me so that I get it better because I really do think that Chinese medicine is the best thing ever. Like seriously, I don't go to anyone but my Chinese medicine doctor for my health problems, and she
Mhm.
solves them in such a short period of time that it's almost like creepy. Whereas I know I would have gone to a Western doctor and I would have been there for hours and they would have been confused and then they would have
Mhm.
given me some medication and sent me on my way. So
Mhm.
so the whole idea of like what is the basis of approach? So I understand a bit about chi. I've heard things about five element theory, but I don't know if that's a US thing or if that's a
Mhm.
real tenet. Can you break down for me what is, I guess, the overarching I guess philosophy that you approach health?
So there's so many aspects to it. Let's see, where should I start? So the chi, so basically the in terms of chi, I guess here I feel like there's so many different interpretations of what chi is, right?
Yeah.
But basically it's kind of like the life force or energy that runs through your body, right? So in Chinese medicine we can say there's like so when we diagnose patients, for example, we can say, oh, you have qi deficiency, or you have qi stagnation, you have qi excess of qi, in certain parts of the body. Let's say you have so in a way, it, for optimal health, we believe that you want the qi and the energy to be running smoothly, right? Like a kind of a river running smoothly. You don't want any obstructions in the river, right?
Yeah.
So things like we tend to look at the body as a whole, right? So you have different systems in the body. You have the and different channels in the body. So you have the spleen channel, you have liver channel, kidney channel. You want the chi to be sufficient and running smoothly through all these um, meridians or channels. And when the and there's things that can affect the energy of these channels. So for example, your diet, lifestyle, whether you're getting enough sleep, stress, all these different aspects of life, like where you live, your environment, all these things can affect your chi or your energy.
Yeah.
So when the body experiences some sort of stressor, or let's say you're worrying too much, working too much, not eating properly, like these things can affect certain channels, some channels more than others, right? And then that can cause stagnation of chi. So for example, let's say women trying to get pregnant or you know if she's under a lot of stress and she's working too hard, we say this can cause liver chi stagnation, right? Then she can when that happens, that can give her more PMS symptoms, or so just um so in general we just want the chi to be running smoothly.
So in running the chi smoothly, I understand that acupuncture in itself helps to open up those channels and allow the chi to run smoother, right? If there's
Hmm.
blockages, the acupuncture is like a self-healing tool that then will help
Exactly.
to modulate those things,
Hmm.
right? So are the herbs also considered a part of balancing the chi?
Yes, for sure. Yeah, and then each different herbs enter different channels, right? So in the body, so let's say some herbs focus on the liver and heart channels, some herbs focus on the kidney, stomach channels. So yeah, so basically the purpose of the herbs is also to create help to unblock. the channels or help to improve circulation in the channels, help to tonify where there's deficiency or help to remove excess where there's excess energy stuck. Uh-huh.
Okay. So is it too far to say that when you think about it in Chinese medicine, that then to be in health means to have your qi flowing freely in the right amounts?
Right. Uh-huh. Yes, that's correct. Uh-huh.
Okay. So
Yeah,
then to not be in health would be to have all these blockages or different blockages in different places.
exactly. Either blockage or deficiency or too much or excess in certain areas. Uh-huh. Yeah. So it's
Aha. Okay.
the,
That
the
makes
whole
sense.
yin and the yang.
Yes.
Yin yang. You don't want too much. You want some yin, but you don't want too much yin. You want yang, but you don't want too much yang. Right. So they have to be in the right balance with each other. Everything's about
Yes.
balance.
Balance.
Mhm.
Okay, that makes a lot of sense. Okay, okay, I get that part. So let's talk about women's hormonal balance. So then, when you're
Mhm.
looking at someone who has hormonal balance issues, I have a lot of clients with PCOS. That's a whole thing. That's a whole thing in itself. But
Mhm.
fertility issues, hormonal balance issues, what types of blockages are you typically going to see? Is it going to be different for different people, or are you going to actually see kind of patterns happening a lot?
You tend to see, I mean, you definitely see different things in different people, but I think, um, but you also see patterns with certain types of issues. So, for example, like women who have fibroids or PCOS. Well, let's take PCOS for example. So, in Chinese medicine, we see that sometimes women with PCOS tend to have more phlegm damp stagnation issues in their body.
Mm,
So we would maybe consider their body as having being more of like a phlegm damp constitution or spleen chi deficiency with phlegm damp constitution. That's how we would diagnose it. Um,
okay.
any type of cysts or let's say whether it's cystic acne or like ovarian cysts, or whether it's fibroid type of, fibroids, these growths in the body, we often we see them as like phlegm damp nodules or phlegm damp excess of phlegm damp stagnation in the body. So
And does that also connect to the temperature of the body as well?
it can, yeah. So someone who tends to have coldness in the body may also have a tendency towards more phlegm damp stagnation, right? It's kind of like we also like your digestive system in Chinese medicine, we see it as like, it's almost like the fire on the stove. The fire, if your fire is sufficient, it helps to process and cook the foods properly, right? If the digestive fire is not sufficient, then your foods don't cook properly. You have all this like water that doesn't evaporate as it should. So then you end up having all this accumulation of water or dampness in the body if the digestive fire is low.
Very, very interesting.
So then for
So, uh, PCOS, the people you've treated before, are you also doing herbs there as well as
well,
acupuncture?
yeah, for PCOS, you really need to take the herbal teas. And PCOS is definitely can be treatable with Chinese medicine and also diet modification and the but yeah, the herbs and acupuncture both are equally important for PCOS patients.
Love it. Love
Hmm.
it. And then what about infertility?
Uh-huh.
Like what
Infertility.
kinds of blocks or things that you see commonly in a woman who says, I can't get pregnant, or they're miscarrying often or stuff like that?
Yeah, this is there's so many different aspects to for infertility. So I would say from a TCM point of view, let's say everything structurally looks normal. So they're if they let's say they don't have any uterine issues, the fallopian tubes are clear, like everything structurally looks normal, but the patient's still not getting pregnant, kind of explain not being able to get pregnant. So then from Chinese medicine point of view, we often for women especially, there's the spleen, liver, and kidney channels are the most important channels or meridians for the body. So we kind of focus on nourishing the spleen chi. This is from a TCM way of saying talking. Like we nourish the spleen chi, nourish the liver and kidney, yin and yang energy. make sure the liver qi is flowing smoothly. So a lot of women, because the fertility journey can be so stressful for a lot of women, it often causes, we say, like liver qi stagnation, right? So in Chinese medicine, liver, the emotions and anger, frustration, all these things can affect the liver channel. So when we tell a woman there's a lot of liver stagnation, it means that there's also a lot of stress and just emotional element to the infertility. So through the acupuncture, through the herbal teas, we try to really balance the spleen, liver, and kidney channels. Um, and then, of course, meditation, yoga, things that can help her reduce her stress. That's really important. Also, making sure she's getting enough sleep. Um, so those are some of the things that we focus on with infertility patients. And then, of course, the egg quality too. Like egg quality can also be a big factor. So more and more women these days are getting pregnant in their mid to late 30s or even 40s. So we say that, as you get into your late 30s and 40s, the egg quality can be affected. So from a TCM point of view, to help improve the egg quality, we focus on kind of nourishing the liver kidney essence or kidney essence. So that has a lot to do with reproductive function and egg quality. A lot of the herbs that we use that help to nourish the kidney essence or kidney yin and yang, kidney jing tonics, those are all kind of egg quality improving type of herbs.
Super cool. Um,
There's so many different things that you need to consider. And obviously, you would work together with your gynecologist or your fertility doctor to make sure that everything is, the uterine is good, the fallopian tubes, the male aspect of the fertility also is very important.
yes.
The guy checking the husband or the partner. Mm-hmm.
Yes, no, for sure. You mentioned something which this is one of the reasons why I love Chinese medicine. I feel as though when you go into Western doctors, a Western doctor's office, your emotions are disregarded or they're
Oh,
not really even taken into consideration when it comes to your diagnosis or
right.
your
Yeah,
health imbalance.
that's so
But
true.
if I go into my Chinese medicine doctor, I feel this deep sense of being seen. Like you can't hide because
Mhm.
this person's looking at you, but they're also looking at you seem a little stressed these days. Like what's going on with you? You're like, oh.
Yeah.
Um, so can you explain how the emotions are tied into all of this, into the health philosophy, into the treatment?
Oh, so I mean, I feel like I almost feel like I think TCM has, and a lot of even Ayurvedic medicine maybe, but we've already known the relationship between the spirit and the physical for such a thousands of years already. So it's just ingrained in the philosophy of Chinese medicine. I feel like is we call it, say, Jing Qi Shen, right? Jing is your essence, Qi is your flow of energy, Qi. Shen is like your spirit, right? So like these three things have to be in balance because they all affect one another. But yeah, so basically, yeah, I mean the relationship between your health and your mental health, your mental spiritual health, and your physical health is just so important in Chinese medicine. And that's why the acupuncture
Hmm.
also helps too, I think. Yeah, because it
Well,
really
it's so interesting because acupuncture also can affect your emotions. I'm not sure that many people know this, but people can give you acupuncture treatment to treat depression or any sort of like,
mm-hmm,
emotional imbalance, which I find fascinating.
mm-hmm, mm-hmm. Yeah, for sure. Even women who have like PMDD, who have really severe like PMS symptoms, where they get really depressed around their period time, like the acupuncture helps a lot, together with the herbal teas too. But yeah, I think the acupuncture helps to relax the nervous system and turn on the parasympathetic response in the body, right? Like the rest and relaxation response. So that's also
Yes.
has effects for the rest of your body as well, right? So better, when the rest and relaxation turns on, then you have better blood flow to the digestive organs, to the reproductive organs. There's less stress hormones, cortisol running through the body, less inflammation. So it's just overall good for your body. Mhm.
Got it. Um, and can you explain what birth dates, like, do you ask your patients when they were born, and what does this tell you about their particular health issues, like the when they were born and the actual date of their birth?
That's a good question. I don't, that's not really my specialty. I don't know if your Chinese medicine doctor does that, looks at the date of birth, but like for
She
me, I
does.
don't really consider that as much, to be honest. Um,
Okay, I've had a few who have, and they kind of like take and from what I observed, but I don't quite understand it. They kind of like
mhm.
take the date in which someone was born, and then they can kind of generalize on what types of health conditions that person may suffer based on when they were born. And I'm not sure what it's tied to. I have not yet figured
Mhm.
it out. But I
You know
find
what?
it fascinating.
That could be like a whole other podcast episode you could ask.
I
But yeah,
think so.
that would be an interesting topic though. Yeah, not one
No,
that I'm
totally.
familiar with.
So for PCOS, like I feel like Chinese herbs are very complicated, but are there specific herbs that we would know of that you feel like are really great that are part of the treatment generally?
Oh, for you're saying for PCOS specifically? Oh, well, I mean, it really depends on the person's diagnosis, right? Because within PCOS and TCM, there could be different diagnoses within PCOS depending on the patient's
Hmm.
constitution. So, like for example, some PCOS patients have the whole metabolic issues, like the metabolic syndrome, where they have like elevated blood sugar and or high cholesterol. Let's say, for example, then we consider them more like, let's say, spleen chi deficiency with damp stagnation. So then herbal medicine, the specific herbs I don't know that you may not necessarily know the Chinese herb that we use for it, but but yeah, so that would be one way of treating it. So we would use certain formulas. Let's say you know um, it can be tang or tang, like certain formulas that we have that help nourish the spleen chi. And then also if they have like high blood sugar, there's also herbs that help to improve the body's sensitivity to insulin that they often use in the for like people with high blood sugar. So then we use those type of herbs. We might use the hawthorn berries, for example, like the hawthorn berries it's often used for like people with high cholesterol, but it's also really good for digestion. So when you eat like fatty meals or something, that's a particular herb that we may use in their formula. Let's say if they have digestive issues, um, and then but then some PCOS patients may have different diagnoses, so they might have like kidney deficiency. So then we would give them different types of herbs to help with that aspect of their health.
When you say deficiency, do you mean more like it's not operating all the way, or is that the deficiency of qi?
We say it can be the kidney, like kidney essence deficiency or kidney gene deficiency. So in the sense that
Hmm.
their follicle or their egg is not growing properly, or they might have had it since they were young, like especially if they've had PCOS since they were in their teens, like really early on, and also we also base it on their blood results. So all these things we take into consideration, on their diagnosis. Mhm.
Hmm. Super cool. And from your perspective, I guess I'm just curious, what what is from your perspective is the best way for Western and Eastern medicine to work together?
I think they actually work like they were actually work well together, especially for fertility. Like you really do have to look at their. Oftentimes we'll look at their like hormone panel results, right? Their metabolic panel. All these things will help us also with the Chinese medicine diagnosis and knowing how to treat them going forward. But we do work with a lot of fertility doctors or the gynecologists, um, making sure that the herbs and the treatments don't contraindicate what the patient is, what what the patient is going through in their fertility journey. So, if they're doing embryo freezing, IVF cycle, like we always want to try to work together with the doctor and the patient to optimize their fertility treatments. So, was that kind of your question? Or for
Yeah,
example,
no, I think that that makes the
and also like patients, for example, who have gastrointestinal issues or digestive issues, like oftentimes we'll have them do tests to like nutrient panel, like a nutrient test or food sensitivity tests, or sometimes they'll check for if they have SIBO or H. pylori or candida overgrowth of yeast in the body. Like we all we do like to look at their Western medicine results as well, and that will help us further optimize their health. So sometimes we will also combine supplements as well with their with their treatments, or the patient may have to
love
take
it.
medication. So yeah.
Super cool. Last question, I guess, from your perspective, I guess as a practitioner and just as a human being, what do
Mm-hmm.
you, if someone was interested in longevity, what would your top things be to focus on?
Longevity. I would say ugh, longevity. Your I feel like your mental health and your support network, your support group, your community, like all these, I think are really important for longevity. Your diet, trying to eat a diet that's has more unprocessed whole foods, trying to avoid all these processed high sugar, alcohol, caffeine, these things are not good, I would say, for longevity. So we focus a lot on the diet aspect. uh, Moderate exercise, whether it's tai chi, yoga, going for walks, hikes, like spending time in nature, like those are also really important, I feel, for longevity. Yeah, I think keeping things simple, keeping life simple.
Yeah. try
Like I feel like,
try doing
yeah,
that in 2021 and see how that works for you.
yes, I know. Let's hope 2021 is good for all of us.
I
Better,
know, right?
yeah.
Thank you so much, Dr. Lim. This is really informative. I learned a lot.
Oh, great! It was great talking with you, Asosa. Yeah.